Welcome everyone to the Carer Gateway webinar. My name's Vicky Down. I'm the State Manager of the Carer Gateway from Merry Health. I'd like to also begin by acknowledging the traditional owners of the land on which we all meet today and pay my respects to elders past, present and emerging. For those of you who are joining us today, there is a Q&A tab on your screens. So if you have any questions, please feel free to type them in and we'll respond to most of them at the end of the presentation. For those questions that we don't get to today, we'll respond back to you at a later time. I'd also like to introduce Sam Shoemaker, who is the coordinator of the intake team for the Carer Gateway, and Sam will also be responding to questions today and also assisting with the presentation. So once again, welcome and thank you for your presence today. Now, the first part of the presentation is basically just a definition of what is a carer. Not many people know that they are a carer. So a carer is a person who provides unpaid care and support to a family member or friend with a disability, a mental illness, a chronic health issue, or an age-related condition. Becoming a carer can be gradual or it can happen suddenly due to accident or illness. Carers can be any age. Children and young adults are often called young carers. 1 in 8 people in Australia are carers. So there are about 2.7 million carers across Australia, and in Victoria, there are about 750,000 carers. All caring situations are different. Some carers look after another person 24 hours a day and help with all the daily living tasks, while other carers look after people for a few hours to help with everyday things. So you might be a carer who assists with shopping or banking or taking someone to appointments. The Carer Gateway is a national initiative funded by the Australian Government via the Department of Social Services. The Carer Gateway is the website is a primary source of information. It provides clear and practical advice to carers that assists them with challenges that they're facing due to their caring role. Carers can also connect to the local Carer Gateway service provider via the 1800 422 737 phone number. That's a free call number, and that can be contacted anywhere in Australia, and you'll be put through to your local Carer Gateway service provider. In Victoria, that's Merry Health with its partner agencies, which I'll talk about in a minute. So the Carer Gateway connects carers to the services they need through either the Carer Gateway website or through the Carer Gateway local service providers. So in Victoria, we have a consortium of 7 providers led by Merry Health, and the group includes Alfred Health, Ballarat Health, Barwon Health, Bendigo Health, Family Care and Uniting Victoria Tasmania. So all of those providers, including Merry Health, deliver Carer Gateway services across Victoria. If you contact the 1800 number, you'll go through to the central intake team, and then your call will be referred to one of our local partners. So with the Carer Gateway, the carer is at the centre of services. The Carer Gateway was co-designed by carers in consultation with the Commonwealth and service providers. And the aim of the Carer Gateway is to make sure carers are at the centre of everything. The main principles of the Carer Gateway are, it's an early intervention service. So basically it's there to support carers before they reach crisis points. So in order to build capacity of carers and also put in services that are going to support carers so they can avoid an emergency situation. Another main principle of the Carer Gateway is to provide a consistent and accessible service experience to all carers. So that's why we have the 1800 number, also the Carer Gateway website, and you can also contact the Carer Gateway in person. targeting carers most in need. So again, as I said, it's a preventative approach. So hopefully with people knowing more about the Carer Gateway, they're able to identify themselves as carers and contact the service so we can put in some supports when they're most needed, but also supports that will continue to provide you with assistance on an ongoing basis. The services are aimed to improve carers' quality of life, because one of the things we've noticed with carers is they put themselves second, and they ignore things like their own health and well-being. They ignore their own life, and so they put the care recipient in ahead of themselves. So the Carer Gateway can assist with things like helping carers to engage with education and training, or to re-engage with employment, or also to link them into other support services, as well as other carers who are experiencing the same thing. What services are available? The Carer Gateway includes a range of services. They're the online digital services, so they include peer support, counselling, online coaching, online skills courses, and education materials, and all of those are available from the Carer Gateway website. Other Carer Gateway services include carer-directed support. These are packages that are available to carers. There are two types of packages: $3,000 package that's available across a 12-month period, and a $1,500 package that can assist with things like purchasing of equipment, such as a laptop to help carers re-engage with employment or re-engage with education. The Carer Gateway also provides counselling, so carers are eligible for up to 6 counselling sessions. We also provide carer coaching, which looks at individual goals for carers and what you need to do to achieve those. There's an in-person peer support service. We also deliver emergency respite and also assist carers with carer support planning. So I talked a little bit about the carer-directed support packages, and this is just more information about it. The carer-directed support service is aimed at supporting carers in their caring role. It gives a greater say and more control over the support provided to carers and the person they care for. Support may be offered in one of two forms. As I said earlier, there's the one-off practical support that might be used for items such as purchasing of equipment to assist carers in education or employment, such as a laptop. Payment for training courses. So a lot of carers would like to attend conferences or other training courses. So the one-off practical support allows us to purchase those services for carers. Carer-directed packages can be directed towards a range of practical funded supports to assist carers as well. These packages are over a 12-month period. They're up to $3,000, and they assist carers with planned respite, or assistance with home care, such as cleaning, assistance with shopping, cooking, or assistance with transport. So we can assist with taxi vouchers to to assist carers to attend medical appointments, or any other appointments that are for the carer or for the care recipient. Counselling, it's the Carer Gateway Counselling service is a free service for carers. It's available from 8 a.m. to 6 p.m. We have professional counsellors working with us who can discuss concerns, feelings and strategies to help carers manage in their caring role. There is also a carer counselling telephone-based service that's offered by Catholic Care. So when you call the 1-800-422-737 number, you can select either to go straight through to the carer counselling service, or you can select to come through to your local service provider, which is Mary Health and its partners in Victoria. So the the counselling is usually done face-to-face, but unfortunately at the moment with COVID, that's not possible. So we're offering the counselling, either phone-based counselling or telehealth counselling. So carers who usually want to see a counsellor for various reasons, it could be because of feelings of anxiety and depression or stress. Counselling can help carers manage their own well-being. As I said before, it's up to 6 free sessions, but during this time with the stress associated with COVID, we're able to offer more counselling sessions. And as I said before, it's available over the phone, online or in person. Carer coaching is a new service for the Carer Gateway. It launches officially on the 1st of July 2021, but in the meantime, if carers require some assistance to work towards particular goals, they can request carer coaching. So carer coaching provides carers with an opportunity to think about how you're going, how you'd like things to be, and how you can take steps towards making that happen. The sessions are one-to-one. They're offered, the carer coach is a trained coach. They can meet with you in person, online or over the phone. And at the moment, as I said, in person is probably a bit difficult given the stage 4 restrictions, but it can be offered over the phone and online. Also via the website, there's self-guided coaching sessions, and these are available via the Carer Gateway website. There are, I think, 8 modules, and they explore topics like finances, health, emotions, relationships, work, study, and more. And these are designed for carers to work at their own pace. So you can actually access those modules by going to the website and registering, and then you can access those at any time. In-person peer support is another service we offer. It's a free service and it's peer facilitated. So what it does is it connects carers with other carers in similar situations, gives carers an opportunity to socialise with other carers, to learn from their peers through sharing their lived experience, and it also provides relief from carer stress through personal connections and stories. So we've got a very extensive network of in-person peer support forums. So if carers are interested or they feel isolated and would like to meet other carers, please feel free to contact the Carer Gateway and we can link you into the most appropriate support network in your area. Respite, that's one of the things we provide. So with Respite, it's for those who are hearing the word for the first time, it's when someone else takes care of the person being cared for. So basically we put in supports, either in-home supports or facility-based support. So what it does is allows carers to have a break. It gives carers an opportunity to do things that they would normally do, which is go shopping or go out and have a coffee or with a friend. So it's there to give carers a break so they can continue to provide care for their family member or friend. So the respite care can be short term, so it can be for a few hours, or it can be for a longer term, including overnight. Planned respite care is something that we help carers with. So if you contact the Carer Gateway, one of our assessment and planning officers will work with you to put in a plan in place so you can get some regular breaks and that you can access services when you need them. We also provide emergency respite care, which is available at short notice, and that can be both in home or in a residential facility. Carer support planning helps carers think about what it is that's important to them, and allows carers to talk through what some of their issues are and what services are most suitable for them, and the assessment and planning officer that works with the carer develops a care plan that looks at what the support needs are of the carer, but also it looks at their well-being. So the carer support plan will enable the carer to have some sort of control over their own supports and what they need. The carer support worker can explain the range of supports available and talk with carers about what services may fit their needs. They can organise referrals to services or provide information for carers to make their own inquiries. Carer support workers keep in touch regularly and work to ensure that needs are being met, that support is sustainable, and they also check in on carers' well-being. So how does it work? How do you get in touch with us? There's a number of ways. You can browse services by visiting the Carer Gateway website, or you can call the Carer Gateway team on 1800 422 737. We're available Monday to Friday, 8 a.m. to 5 p.m. We also offer an after-hours service that's for emergency respite. So if you're in a situation where you require an emergency, where you require emergency respite, you contact the 1-800 number again, and you get put through to one of our after hours providers who will support you to access respite. You can also contact the Carer Gateway by registering on the Carer Gateway website. There's also a facility on there where you can ask for a call back. So what will happen is you just register a couple of details, your name, phone number, what's the best time to call you back, and one of the Carer Gateway staff will give you a call. And I mean, that's it in terms of how you contact our service. So as I said, there's the 1-800 number, there's the Carer Gateway website. So I'll leave that up there for now, but I'm happy to take any questions. But before I do that, I might just introduce Sam, who's the intake coordinator. Sam manages the intake team, and I just wanted to just ask Sam if he could just speak a little bit about intake and what the process is.
Thanks, Vicky. As Vicky said, our team is open from 8 a.m. to 5 p.m, Monday to Friday. And then after that, we have an after-hours service to support carers who require emergency respite. When you call through to the Carer Gateway, the first thing we'll be doing is checking, confirming that you live in Victoria and that you also are in a caring role for one of the groups that we spoke about earlier, which is you're either in a caring role for a family member or friend who might be impacted by a disability, a mental illness, be frail, aged, or have a chronic illness. We'll also be creating or registering you with the Carer Gateway and taking down some basic details about yourself as a carer and also the person or people that you care for. At that point, we can also offer emergency respite. So, and we can, assist you in the event that you have an emergency respite need, such as, you need to perhaps go to hospital or you're unwell, or there was some significant carer stress as a result of your caring role. And the team can assist you with that support. So we can arrange emergency respite supports such as in-home supports or perhaps residential supports to assist you in that during that emergency situation. Once we've completed those two steps, what we'll do then is we'll assign you across, depending on where you live, to get some follow-up support and assistance and start that carer support planning so that we can assist you into some more ongoing supports, such as the ones that Vicky's touched on, including peer support, carer counselling, and packages and those things as well. So yeah, so I think I've just noticed there was a couple of questions about the time. So I think I've covered that one in terms of our when we can be contacted. Yeah, so the first step is a very sort of short step so that we can get you into the system, onto the Carer Gateway, I should say, and then get you linked in with a local service provider, and so that you can get those ongoing supports in place, such as the ones I touched on earlier. It also is based on where you live as a carer. So depending on where you live, you'll be linked into one of our Carer Gateway partners. So for example, if you happen to live in Frankston, you'd be linked into our Carer Gateway partner in that region, which will provide those local services to you, which is Alfred Health. Similarly, if you happen to live in Geelong, you would be linked into our Carer Gateway partner down there, which is Barwon Health. And yeah, we've got providers that cover across Victoria. I think that was the main thing.
Sam, we might just answer some of the questions, I think. Sure. So we've got, there's a question, and we'll share this. Can the Carer Gateway be contacted 24/7? Yes, it can. So the 1-800 number is contactable every day of the year, 24 hours a day. We are available from 8 a.m. to 5 p.m, but after hours, we have a provider who will respond to any emergency respite requests, or will take your details, and then one of our staff will contact you the next business day. There's a question here about the $3,000 package. Is it paid for by Commonwealth funding through the Gateway? Yes, it is. So it's a Commonwealth funded service, and to access the carer directed support packages, you need to register with the Carer Gateway. There's a question around carer counselling. Is it available via Carers Victoria? No, it's actually through the Carer Gateway. So if you're interested in receiving counselling, you just contact, as I said, the 1-800 number, and we'll link you into a counsellor in your local area. Now I'm going, this next one, I might, Sam, are you able to respond to this? It's regarding a cognitive assessment for a carer who needs their own NDIS plan.
So it's for the carer themselves. I'd say that would be done through the NDIS package rather than through the Carer Gateway. That I can have a look at that, but yeah, I think.
So what we can do though, yeah, so we couldn't actually fund that, but what we could do is assist you to engage with, to contact the NDIS, and we could support you through that process. But I'm not sure who raised the question, but I'm happy for us to get back to you on that one with some more information if you want to provide your details. Got a couple of questions around our services. The services offered, are they paid for under Commonwealth funding? As I said, yes, they are. The Carer Gateway is a federally funded program. It's part of the National Carer Gateway network. There's a question around carer directed supports. Can you receive more next year and beyond as your circumstances demand? So with the carer directed support packages, as I said, it's over a 12-month period. So what would happen at the end of that time, or while you're accessing the package actually, there'd be a constant checking in with you to see that everything's going okay, you're getting the supports that you need. At the end of the 12 months, if you still need those supports, there would be a discussion with the carer support worker about what your needs are, and then you could access the package again for a further 12 months. I have a question here. We live regionally. Are the services readily available in regional areas? We have so much difficulty accessing any sort of services where we live. So yes, we have partners in regional Victoria. So our main partners are Barwon Health, Ballarat Health, Bendigo Health. We have Family Care who cover the Goulburn Valley. And then we have Uniting Victoria Tasmania, who provide services in Gippsland and across up until, I think, to Albury Wodonga. So we do offer services across Victoria. If you live, what I suggest you do is contact the Carer Gateway and the 1-800 number, and then we can link you into your local service that also has more information about what other services are available in your area. There's a question there around brochures. Are there brochures that we can hand out to carers when we do an assessment? Yes, there are. And again, we're happy to provide you with that information if you'd like to contact the 1-800 number. The question about what happens when a carer supports a person with high care needs and they need higher support than the allocated support package. So again, part of the role of the carer support workers is to work with the carer to link them into ongoing services. So for instance, you know, you might need to access My Aged Care or the NDIS. So the carer support worker would work with you to do that. We do have flexibility around the sort of support we can provide. So it's all dependent on what the need is at the time. So that you know, in your discussion with the carer support worker, you can identify what it is you actually need and what sort of supports we can provide for you or what we can link you into. The next question I think I might throw to Sam. Yeah. It's around the current estimated wait for callback, Sam.
It's usually probably around 48 hours, depending on, because it sort of varies the amount of callback requests we get coming in on a daily basis. But we try to get through them as quickly as possible, and you know, where possible, do them immediately. Sometimes people are requesting a callback for, you know, later in the week, and you know, so we would do it in that time. But yeah, we generally within the 48 hours it would be a good estimate.
Yeah. There's a question here about ACAS referrals for respite for over 65s. So does a person need an aged care assessment to access respite? If it's in-home respite, no, you won't. But if the respite is in a residential aged care facility, yes, you would need an aged care assessment, but we can assist you with, you know, accessing that, and we can help you liaise with My Aged Care. There's a question around the Carer Gateway. If the care recipient is on a home care package, can the carer access the Carer Gateway? Yes, that's the Carer Gateway. The purpose of the Carer Gateway is to focus on the needs of the carer and provide the carer with support. So if it doesn't matter what sort of support the care recipient is in receipt of, the Carer Gateway can still assist carers. And the services, as I said, that we can provide include counselling, peer support, coaching, and the carer-directed support packages. And they're separate from any other package that the care recipient might be accessing. There's a question here, if you were registered as a carer before, do you need to re-register with the Carer Gateway? If you were registered with one of the previous carer support services, what I suggest you do is still contact the 1-800 number and speak to one of the intake staff, who will then check to see if you're already registered. If you're not, they'll just ask you a couple of questions, and then we'll register you with our service. And I think it also gives you an opportunity to basically engage with the service, get some additional information, and maybe be referred to one of the other carer support workers who can work with you on the supports you might need at that time. So we don't want to make this inconvenient for people, because we know, you know, accessing services means that you've got to tell your story over and over and over again. But the only way you can check is contact the service, and then we can have a look to see if you're already registered, and if not, we'll just ask you some really brief questions, and then you're able to access our service at any time. There's a question here about some technical difficulty receiving a copy of the Carer Star outcome plan. Is this known, and is there a fix? Yes. Sam, are you able to respond to this question?
Yeah, so as it's a brand new system, so yes, it is definitely known. I believe that they can now send the stars out, so I can definitely follow that up. But yeah, that's as far as I'm aware, it's definitely known, and it's something that we've been working on to just resolve that and get that sent out to people.
And for those who don't know, the Carer Star is the assessment and care planning tool that we use to work with carers. So basically, the Carer Star is it's the carer's tool to identify what sort of supports they need, and it's basically guided by the carer. We don't tell you what you need; you tell us what you need, and then our role is to basically support you to access what you need. So the Carer Star is something that is reviewed over time, and it also looks at how you're progressing. So if there's been an improvement in your quality of life, we can document that in the Carer Star, and that belongs to you. That you own that that plan. Another question here about if the person you're caring for is getting assistance from a government package, can you still get help from the Carer Gateway? Yes, you can. What are some examples of in-person peer support? I might actually throw to Sam on this one. Sam, are you able to respond?
Yeah, so I mean, it's slightly different at the moment just with the COVID restrictions, but I understand that a lot of our partners are doing online type groups where they're meeting regularly, particularly in this difficult time where lots of people are isolated because of COVID. But yeah, bringing together people together in those sort of online community type forums and peer support groups. Yeah, but again, once if you come through and register us, then the local your local service can give you a bit more detail about the wheres and the whens and the types of groups that are currently available in your local area.
Sam, there's another question about how long does it take from the time a carer contacts the intake team to the time that they're contacted by their local service provider?
Yeah, I can respond to that one as well. So in terms of when you do contact the Carer Gateway, it usually takes, if it's just collecting some of your basic details and finding out what supports, it usually takes about 5 or 10 minutes just to do that registration with the Carer Gateway. We'll generally assign it straight away unless we're arranging emergency respite services for you as a carer. And usually, usually again, it's probably around the 48-hour mark, but depending on the volume of carers coming through, it should be relatively quickly. Even quite often we'll refer somebody and they're picked up straight away. So there is some variance depending on how many people are coming through it at one time, but yeah, generally it's fairly quick.
We've got another question here about what does in-home support mean? And in-home support, yes, it does mean someone coming into your home to provide you with support so you can go out. So if you wanted to go out for a few hours, a respite worker would come into the home and they could keep your family member company, or they could prepare lunch for them or take them out. But it is in-home support for you, so you can go out and do something yourself. Sam, were there any other questions you wanted to respond to? There's quite a few coming
I'm
through.
just working through, yep. So there's a question about if you're...
Yep, sorry, Sam.
Sorry, yeah, if there's a question about if you're linked with Merry Health, do you still need to register? I would probably, yeah, we will definitely have your details on file, but it's probably, as Vicky said, it's probably worth just calling through anyway, just to make sure that we've got everything up to date and there hasn't been any changes, and then we can, yeah, get you across to our the carer support team that is Merry Health in your region to provide that support for you.
Have we talked about
another one? Packages.
Oh, sorry, Sam.
Vicky.
I was just, yeah, go ahead.
They're not, so there's a question, are the packages through Centrelink? And they're not, they're through, they're part of the Carer Gateway, which is the Commonwealth funding, so they're quite separate to that.
Is it possible to get more information about the packages? Yes, of course. You could contact the Carer Gateway and one of our carer support workers will be able to talk to you about that. There are also some brochures we can send out to you, we can make available. But the $3,000 packages, as I said, they're over a 12-month period and they're there to support the carer with things like personal care for the care recipient, respite, assistance with transport, assistance with meals, and those packages are reviewed after 12 months.
There's another question about the $3,000 packages. Are they independent of Centrelink carer payments? And the answer is yes. So they're quite different to, you know, Centrelink carer payments and so on. So it's a, yeah, quite a separate, separate, yeah, sort of system.
There's a question here about what would be the time length of respite. Example, if the carer needed to go into hospital for a procedure. Again, it all depends if it's in-home respite or whether it would be in a residential facility. So it's really dependent on the situation. So again, I'd encourage you to contact, but we do provide respite for carers who require hospital admissions, even if it's an emergency respite request. If the carer is taken ill suddenly, we can also support you with that. Is the Commonwealth funding means tested? No, it's not. We don't means test. We have someone who, yeah, sorry, Sam.
There was a question just regarding registration again. Was registered with Barwon Healthcare Support Service. So do I need to register with the Carer Gateway? Yes, the answer, if you, it'd be best just to call through and we can double check to see if you know, if that registration has come across. Otherwise, we'll do that quick registration and then you can get your link back in with Barwon Health to get those services.
There's a couple of questions, I think, that are probably related to the National Disability Insurance Scheme. So if people have, and I probably won't be able to respond to them right now, I won't be able to do them justice. So if people have questions about, you know, a son or a daughter who might be eligible for NDIS, please feel free to contact us and we can provide you with assistance. One of the things, we've just recently received funding from the National Disability Insurance Agency, from the NDIA, to assist carers who are over 65 access NDIS supports for their adult children. So if you do need support or you need some assistance, even if you're under 65, it doesn't matter, contact us and we can assist you to get the right supports in place, whether it's NDIS or something else. think the question, we've answered this before, but happy to answer it again. If if the care recipient is in receipt of a package from either My Aged Care or the NDIS, the carer can still access Carer Gateway services. Sam, did you want to respond to the question regarding the carer who lives in Brisbane?
Sorry, I'm just getting to that.
So we have a carer who lives in Brisbane and her mum lives in Geelong. Before COVID, she was able to travel to Geelong frequently to stay with mum. Since COVID, obviously you haven't been able to do that. Is there anything that you can that we can do to help? By all means, call us.
Yeah, I'd say
and then
just
we can have
give
a
us
look
a
at
call.
what supports are needed.
I think that's probably the easiest way, just to give us a call through, and then yeah, we can see how we can assist.
Yeah, there's a question here of, does the Carer Gateway assist carers of an NDIS participant? Yes, we do. Does the Carer Gateway support kinship carer, foster carers and young carers? Well, we definitely support young carers. Kinship carers and foster carers we also support.
There's a question about, it says you have 3 days to get assessment paperwork if the person needs to go to Respite in an emergency situation. I'm assuming that's aged residential respite. What we find is definitely give us a call. We do have a number of, we're aware of a number of aged care facilities that do emergency admissions, so that you can get people in immediately, and then they would do the My Aged Care assessment within the facility, and that's arranged by the facility themselves. So hopefully that answered that question.
There's another question about the packages, the carer directed support packages, and yes, if the care recipient is in receipt of an NDIS plan, you're still or a My Aged Care package, you can still access the carer directed support packages, the $3,000 packages.
And with the $3,000 packages, I guess they're coming from slightly different angles. Obviously, the NDIS package is for the person with the disability, and the $3,000 package is for you as a carer. So I guess there's different intents or for both packages. But yeah, it doesn't preclude you from having one.
Yeah. There's a question, do you need to register with the Gateway by phone before doing the 8-module self-guided coaching on the website? No, you can just go access the website directly, the Carer Gateway website, and you can register for the modules, and then it's just self-guided, so you don't need to contact the 1-800 number to do that. In terms of applying for the funding, you just need to contact our service, our intake team, and they will assist you. As Sam said, they'll take some details and then refer you to one of our carer support workers who will develop a plan with you. And if the funding is the most appropriate support that you need, that will be determined when you undertake that assessment with the carer support worker. There's a question here, can a respite worker take a person with dementia out shopping in the current COVID climate? Yeah, I think that's a tricky one. Yeah, I think there'd have to be a discussion with the carer and the support service. I don't know if it would be the best thing to do at the moment, but I'm not sure, Sam, have we had any requests like that recently?
No, it's typically to stay with the the care recipient whilst the carer themselves goes out shopping. Yeah, rather than the example that's mentioned in that question.
Sam, there's a question from an assessor from My Aged Care. They'd like to know if they can contact the 1-800 number to request a call back on behalf of the carer.
Yep,
the answer is yes.
Yeah, we do get those from time to time. So quite often service providers or you know, My Aged Care assessors or hospitals or so on will use that number to call back. So yeah, that's fine.
There's a question about accessing respite if you work. Yes, we know many carers are working carers. So yes, you can still access respite when you're working. And again, if you contact the service, we can then assist you to put in the right services that you need. And we can also link you into other services in the community that might be able to provide additional support for you. Sam, there's a question there about home help. Can you see that one?
Yeah, probably where I might have to speak to that person. I'm not sure why that was. It's not something that we would do at the intake team because we really only provide the emergency respite. So what we normally do is we'd sign that across to our carer gateway partner to look at potential organising those services on the carer's behalf. Maybe if we could follow that one up afterwards, if we could get the details, and then we can talk to them directly.
Okay, thank you. There's a question: can a respite worker take a care recipient out for a walk? Yes.
Yes.
Do you have a map of areas in regional Victoria, and who are the providers? For example, Benalla and Wangaratta. Yes, we can provide you with a regional map, and the provider is Benalla and Wangaratta is
Benalla is family care, and I think
is it Benalla's family care?
Yeah.
But we can contact you and provide you with that information. There's another question: if the support is separate from Centrelink, are they treated as income? No, it's not treated as income. How many times in a year can carers access respite in a residential facility? Well, with I'm assuming that's aged care. With aged care, carers can access up to 63 days of residential care in a facility, but that can be extended, and that we can assist you with engaging with My Aged Care, so you can so you can extend the time, but it's the actual minimum time is 63 days. There's a question here: does the Carer Gateway offer relationship counselling or similar for people who are caring for their partners and are in need of some help in that area? The counselling we offer is mostly focused on the well-being of the carer, but we can link you in to relationship counselling support services if that's what you need. So we're happy to do that for you. There's a question here: do you provide support for temporary carers? For example, carers looking after lung transplant recipients, usually a 3-month caring period post-op. Again, what I suggest is contacting the service, and then we can talk through what your needs are, and then we can look at what sort of supports we can put in place for you. Because we do support carers of people with chronic illnesses, and I think we would, say that fits the criteria. There's a question about if the carer doesn't use all their package funds in 12 months. As I said previously, it's up to $3,000 in a 12-month period. So if you don't use all of the funding in that period and you need further support in the following 12 months, you would be assessed again for another package. So you don't have to use the full package in that 12-month period, but if you needed more support in the future, that you could access another package.
There's
a question
about
here, Sam, about registering
online.
Yep.
You can't register currently online, so you do need to call through to the 1-800 number. You can definitely call through, on the Carer Gateway website to request a callback, and then we can call you back. If it's a service provider who wants to do a registration on the person that they're working with's behalf, they can definitely send those through as well. But yeah, it's carers would just need to call the 1-800 number. It's probably the easiest. There's a question about, is Respite available in the Benalla, Wangaratta areas in Victoria? Yes, we do have Respite providers in that region, or in those two towns. So yeah, we can assist with that.
A question around the home cooking service. What it actually is if you need some respite, and part of the respite is to prepare a meal for the care recipient, we can make a request to the service provider to do that. So yeah, they can prepare meals if that's what's required.
There's a question about who the agency partner is in Doncaster. That's Uniting VicTAS. Is the Carer Gateway partner in that region. There's a question around peer support groups and funding of peer support groups and activities. Again, it's probably just because of the current sort of situations with COVID, it's kind of restricted some of those peer group activities that perhaps would normally run out in the community. But again, it's probably if you just call through and we can register, and then you can have a discussion with the local Carer Gateway partner in your region, and then they can give you a bit more of an idea of what's available in your area.
We've got 4 minutes left, and there's quite a few more questions that we're trying to get through. So if we don't get a chance to respond to your question today, we'll definitely respond to you in writing. So I apologise if we don't get through all of them. Sam, were there any others you wanted to respond to?
Just going through. There's quite a few questions about counselling. Maybe if we can sort of package them up and we can respond, because I think there's some similar type questions.
There's a question, what happens if there is more than one carer for a person regarding who can receive the package? With the service, we identify the primary carer. So usually, you know, there's one person that might identify themselves as being the primary carer for that person, but we do have situations where we have co-carers, particularly if it's around an older parent. So we do have situations where there are siblings caring for an older parent, or a spouse and an adult child caring for an older parent. So again, we'd look at the situation. We do provide support for both carers if it's required. There's a question here in the Southeast Catchment, Dandenong, who is the partner agency? That's Alfred Health. Who provides the service in Mansfield? I'll hand that over to Sam, because he knows regional Victoria better than I do.
I think that's Uniting VicTAS. No, it's Uniting VicTAS, I think.
Right.
Yeah, no, it is. Yeah, it's a Uniting test.
We can get back to you on that one. There's a question. Did you respond to the question about how many times a year can a carer access counselling, Sam?
No, I haven't. That one.
Okay. Well, as we said before, it's 6 sessions. Initially, you can access up to 6 sessions, but if you require, you don't have to use all of those 6 sessions, and if you require counselling further down the track for another issue that's come up, or you still need some additional support, we're happy to assist you with that as well. There's a question
about
sorry,
in-home respite providers, and sorry, the question is: do you have a choice as to who provides the in-home respite? Can you your choice of a worker with their own company, like an NDI self-managed participant? With respite providers, we need to have an agreement with the respite providers or in-home respite providers that we use, and that's just to make sure that they meet all our requirements, such as having, working with children's checks, police checks, they've got appropriate insurances, all those sort of checks and balances are covered off. So we have quite an extensive list of providers across Victoria, and yeah, so we'd need to use one of those providers. So hopefully that answers your question.
Now we've got 1 minute left, everyone, so I think we might just wrap it up now. Thank you so much for joining us today. If we haven't had a chance to respond to your question, we're happy to respond in writing. We really appreciate your time today, and if you'd like to contact us, please feel free to ring the 1800 number, 1800 422 737, or go via the Carer Gateway website and request a call back. So we look forward to hearing from you.
Just quickly, sorry to interrupt you. Mansfield is covered by family care. Sorry, I got that wrong.
Okay, thank you, Sam. So once again, thank you very much for joining us today. We will be doing more of these in the future. So this was our first. So I'd like to say thank you to Sam as well, and behind the scenes, Anita and Dan, for responding to questions and organising the event today. So thank you once again for joining us.